Hi, I'm Maya Hamoud. I'm the principal investigator on the Right Resident, Right Program Ready Day One grant.
My name is Sally Solari. I am a resident physician at Case Western Reserve University.
Jesse Rafael, second-year hospitalist at NYU Langone.
Luito Edgy, Associate Dean of Graduate Medical Education at the University of Cincinnati College of Medicine.
So imagine it's year 2025. Our grant has been extremely successful in implementing some standardization to the process, which is really relieving a lot of anxiety for the applicant. Imagine you, the applicant, has the ability to actually enter your information in the alignment check index, and you get a list of programs that are actually seeking an applicant like me. These are the programs where I'm going to learn and grow with values that align with mine. They decide which are the top 3 programs that I want to apply to in an early result acceptance program. Programs interview applicants over the next couple of months, and we're not just looking at grades, we're not just looking at scores, we're looking at all your entire experiences and interests. The entire application process becomes a lot more holistic. That's what we call the application review metrics. So once the applicant matches, then they can spend the rest of their 4th year of medical school really focused on preparing for residency. The applicant does a self-assessment to see, am I ready to start residency on day 1? Whatever are the gaps for them, they will connect with resident learning communities at the program. They're working on whatever they feel is going to prepare them for residency. This is where the resident curriculum, or what we call Rrr right now, will be ready, so the applicant can pick from a menu and say, you know, I could use more help in time management, for example. They'll have the opportunity to discuss it either within their cohort or with a coach that is assigned to them, so they can discuss what their needs are.
I think looking ahead, if we could envision this future state where the activities of this grant are successful, we really are hopeful that by providing more information, both the applicants and the program, we can increase the alignment between the two. Applicants can apply to programs that they are genuinely interested in and are very likely to do well in.
What's absolutely most important is by making changes to the way the match process is, students will come out more well. By being able to structure the process, you give the students autonomy, you give them more time, you give them a sense of empowerment. And that is incredibly important, not only to have a successful 4th year, but also to set yourself up for success as a future resident.
And from the institution standpoint, the better experience that residents have, the more likely it is that they're to actually be retained as attendings and fellows in our institutions. When you think about learners, the time frame that we have in training is just a drop in the bucket of their careers. And my perspective really is the next 40 years. These folks will actually be practicing in 2060. And I absolutely think that this program sets a great foundation for great ripples into the future.
To actually meaningfully enact change to support our students and our trainees, we have to kind of put action into our words, and I think this is a huge way in which we can do that.
So yeah, I really think that in 2025, through this work, the experience of applying to residency will be so much less stressful, so much clearer for applicants and programs. The costs will be dramatically reduced while increasing the efficiency substantially, and most importantly, making sure that applicants are absolutely prepared on day 1 and excited for their intern year.
The Right Resident, Right Program Ready Day One team is very large. It has over 200 volunteers from all over the country, including many learners, medical students and residents, MD, DO, international medical graduates. So we're very excited, we're very thankful for the entire team that has really been working very hard to actually improve that transition.